everyone. Well, we are talking about women's hormone health. We women go through all kind of journey, the health journey, and we feel this is such an important topic to continuously keep talking about. We have Dr. Simmons with me. She is a functional medicine MD focusing on prevention and treatment of breast cancer. Thank you so much, Dr. Simmons, for supporting us and joining us today.
Oh, I'm always happy to be here.
I know. Thank you. So let's just understand, first of all, the key milestones where women, all of us, our hormones can go out of balance.
Yeah. So I think that we look at each of those stages along the way, right? So when we first start to menstruate and if you get to a certain age and haven't started to menstruate, then we start to worry about whether or not your hormones are in the right proportion to one another, whether you're making them correctly and that kind of thing. And then we move on to the years of fertility and whether or not you're able to conceive without an issue, what your cycles are like. So in your fertile years, are you having regular cycles? Are you skipping cycles? These are things that would indicate that you're having some imbalance in your hormones. And then later on, as we start to approach menopause, are you having symptoms? Because we really aren't meant to be tortured as we end our reproductive years. So if you are being tortured, that is often an indication that there is some imbalance there. And then of course, after menopause, if you start to have symptoms that mimic what was happening before, if you have bleeding after menopause, if you have tender breasts after menopause, hot flashes, sleep disturbance, all of these things can be an indication of hormone imbalance. And of course, when I'm talking about hormones, I don't just mean estrogen and progesterone, because we are an entire system and everything works intricately with each other. So I'm also talking about cortisol. I'm also talking about your thyroid hormones, since all of this is really working in concert for you to feel the way that you're supposed to feel.
Wow. So that's a very good point that you said, that it's not just only two hormones that you're talking about all the hormones that can go out of balance.
Right.
So now let's just talk a little bit about different stages of women's life. What are the different hormones, the key hormones? Like, for example, menstruation is just like estrogen or something, or when we go into menopause. Is there some kind of a difference that you want to kind of explain us a little bit from the hormone point of view?
Listen, though all those different hormone levels are super confusing, but I think the main message that people should have is that once you start getting your period, you should have a regular menstrual period and you should not feel tortured during your menstrual period. So while these things are common, like depression, like heavy bleeding, like menstrual cramps, they are common, but they are not normal. We have normalized them in our society because most doctors don't know how to intervene, or they're intervening with antidepressants or pain medicines, but they're not doing anything to really get to the root of why you're having all of these symptoms with menstruation. So that's kind of where functional medicine differs, really. We know that it's not normal to feel horrible for 3 or 4 or 5 or 6 or 7 days a month. It's not normal. It is common, and it's common because of the environment that we all live in. It's common because of the standard American diet. It's common due to the chemical burden that we all live with every single day, and all of these chemicals acting like estrogen in our body and causing many, many people to be in a hyperestrogen state. And so while these things are common, they're not normal. So functional medicine looks to get to the root of why your hormones are not acting in concert the way that they're supposed to act.
Okay, so that makes perfect sense. And all of us have been programmed, like brain has been programmed that 5 days we're going to feel miserable, right?
Yeah. Yeah.
Yeah,
That, I mean, that's what we're told. It's normalized,
yeah,
but it's not normal. And it's the
correct.
same thing at the other end of the spectrum, right? So as people approach menopause, we're told that, you're supposed to be miserable. You're supposed to have hot flashes and heavy bleeding and irregular periods. And yes, the irregular periods are a reflection of a fall off of our estrogen, and we are no longer ovulating, so we're not getting periods as often. But you shouldn't be miserable. Ending your menstrual cycle, ending your fertility years, you shouldn't be miserable. And so if you're having hot flashes or unwanted weight gain or sleep disturbance, or mood disturbance, these are all indications that there is hormone imbalance there, but it's not simply the lack of estrogen. That's not what's happening, which is why just giving estrogen replacement, while it may manage the symptoms, causes a whole host of other problems, right? Specifically breast cancer. So you're not solving anything by adding more. And sometimes, and oftentimes, it's really about taking away the things that are causing that imbalance.
Okay, so let's talk a little bit about that. I mean, that this knowledge has to be given to all the women out there. I mean, I feel so strong about it because we don't know, and we assume the way you just said. So let's talk a little bit about the work that you are doing, helping women out there, prevention of breast cancer, how functional medicine, how you're using functional medicine. You used to be a conventional medicine doctor first, and you switched to being a functional medicine
It
doctor.
did.
Yeah. So just give us a brief overview, and this is a quick 10
Yeah.
minutes.
Yeah. So for everyone, it's about decreasing your toxic load. So we are all surrounded by toxins, and we're really, these days, I say we're swimming in a sea of estrogen. I mean, that's really what's happening with everyone because the pesticides, the herbicides, the antibiotics, the all the things that you're cleaning your house with, all the products that you're using on your skin, the plastics that you're drinking out of, that you're storing your food in, that you're cooking your food in, the nonstick pans, all of this is highly, highly, highly complicating our hormonal picture. And so in as much as everyone can get back to basics and eat real food, stop trying to sterilize your world. We need germs. It's the only way that our immune system learns to take care of us. So this whole over sterilization of our environment has hurt us so tremendously because we're all walking around with immune systems that don't know how to handle anything, right? Like any athlete has to train, so too does our immune system. That's where we get strong and how we get strong. So stop over sterilizing the environment and stop, in as much as you can, introducing more chemicals into your body. So really try to pare down your beauty routine, pare down your cleaning routine, stop wearing perfume, stop using harsh chemicals everywhere, in, on you, around you. And this will go a very long way to allow your body to heal, because our bodies know what to do. And given more of what it needs and less of what it doesn't need, the body will heal itself.
That is amazing. And the tools that you use, you want to elaborate, like diet and that
So
all like
I
medications.
work with everyone on making sure that they are eating a nutrient dense, whole food, highly diverse diet. That's really the key for everyone, is to get almost all of what you need from diet. There are going to be some special categories. I happen to be a huge believer in medicinal mushrooms, and you're not going to eat all of them. Lots of them you have to supplement. But most of what you need from a food standpoint and a nutrient standpoint can be gotten from our diet. But then we have to think about all the other things that nourish us. So nature nourishes us, sunshine nourishes us, water nourishes us, love and affection nourishes us. So we have to be really mindful of where we spend our personal time, because you don't want to spend it with toxic people. And so be mindful about that. And while you're taking the trash out, cut off those ties that are not serving you, because it's our love and connection that allows us to flourish and gives us our life's purpose. So living that purpose-driven life, connecting with nature, moving every single day, maintaining strength and flexibility and balance. But in as much as you can do that outside, you have a connection to nature, which only grows the benefits. Having a way to manage the stressors of life, you're never going to get rid of them. They're ever present, but that you can develop skills, that same plasticity that I was talking about before when we develop our immune system. Guess what? We can do that to develop our stress management system, and we can decide what has meaning for us. We can decide what our response is going to be, but that's a skill, and that's a skill that has to be built. So it's all about what you put in, what you keep out, your connection, your movement, your sleep. All of these things put together are what really help us to build our health. And my main platform is that I understand by the time people come to me, they already have cancer and they need a treatment plan. But I am all about giving people a health plan, because as I said before, given what it needs, our bodies know how to heal.
I think that's fascinating. Coming from MD, that's what people need to hear. And I'm so thankful for your time. I know you're very, very busy. This is a quick 10-minute session that we do on a daily basis to advocate holistic health, to your point. Anything else you'd like to add? Maybe you want to share. I know Real Health MD people are, please.
So if anyone is suffering from the symptoms of hormone imbalance, fatigue, unwanted weight gain, brain fog, hot flashes, abnormal periods, heavy bleeding, any of those things, that does put people at increased risk of breast cancer. And I always want to try to prevent rather than treat. So I have a course called My Answer to Breast Cancer, which people can sign up for through my website. It is for anyone who is worried about breast cancer, dealing with a breast cancer diagnosis, had a breast cancer diagnosis in the past, and doesn't want to have a recurrence, or is living with metastatic disease. So you can just go to realhealthmd.com and sign up for My Answer to Breast Cancer.
All right. Well, thank you so much. Thank you, everyone, for continuous support. We have over 200,000 followers, and we are launching workshops with help of Dr. Simmons in breast cancer. And so stay tuned and have a great week, everyone. Thank you. Bye-bye.